Bismillahirrahmanirrahim. A warm welcome to our regulars, and it's lovely to see some newcomers here as well. This is the first monthly development circle for the new academic year. We'll be hosting these sessions once a month, and we have a lineup of really interesting and thought-provoking topics. This month's topic is Living with Depression by Dr. Aman Durrani. Without further ado, I'm going to introduce today's speaker, Dr. Aman Durrani, a consultant psychiatrist and specialist in neonatal psychiatry. Dr. Durani is a previous member of ISB Shura and an old trustee, so a familiar face here for many. This session will be run as a Q&A with a presentation first, and then a Q&A with Dr. Sarah Segal asking questions, which have been submitted anonymously via the link we've sent to group chats. So, Dr. Durani, over to you.
Okay, thank you, Sophia. Bismillah ar-Rahman ar-Rahim. So firstly, thank you for the opportunity to come and speak to yourselves. Been really kind of looking forward to it, so Jazakallah khair. I've just got a few things that I wanted to do by way of introduction, and then we'll get into the kind of the meat of things. So I'll try and share my screen. I'll assume that's sharing okay unless there's any issues. So, yeah, no, thank you. So it's the topic is living with depression. What we thought we'd do is maybe rather than making it a talk or a presentation, which will bore you very quickly, we'll try and make it a bit more interactive. I guess the important thing to say is that we're going to try and focus a little bit mainly on depression rather than all mental health issues, because that's such a vast area that you could end up speaking for hours and hours. So we thought we'd try and focus on depression. So if your questions are related to that, then that hopefully will be a wee bit more focused. And if it is helpful, then I'm happy to come back for future sessions on different topics. There's a few things which are just, you know, as a baseline, I think, just to start with in terms of a bit of housekeeping. So one is really important, that there may be things that come up in today's discussion that is quite emotional for you, might be quite difficult, it might be something that you're dealing with yourself in terms of having any kind of mental health difficulties or depression, or it might be somebody very close to you. No doubt everybody will know somebody that's either had or having mental health problems. So you need to really look after yourself to be able to look after anyone else. So I think anything that comes up in today's talk, you know, you need to make sure, you know, if it's getting a wee bit overwhelming or too much for you, because we will touch on sensitive topics such as self-harming and suicide. You know, you need to look after yourself, and you could just take a break for a few minutes. If you need to go get a bit of water, you might want to come back to it. Or, you know, if it's a bit too much or too raw for you, then, you know, you need to just look after yourself. And if you need help, I've got some contact numbers and helplines at the end. But if you need to speak to anyone, either, you know, with Sarah or anyone in the group afterwards, then please do let us know. So you need to look after yourself, because, you know, sometimes these discussions can be difficult. Secondly, is just, you know, obviously this is not specific medical advice. So if you're giving an opinion, if you're asking a question, usually a bit like any fatwa that you get, you know, it depends on a whole host of different factors and criteria. And, you know, we're giving kind of general advice, so it's not specific medical advice, so you shouldn't treat it as such. But also, this should be a bit of a safe space, in as much as, you know, use this opportunity to ask questions or, you know, give your comments, and the moderators will be looking out for that. Obviously, it is something that is a public forum. You don't know who else is on the group, so you need to be a wee bit careful around that. But if you have questions, or there's ways of, you know, asking questions anonymously, you know, use that space. So that's kind of the kind of general housekeeping. I guess moving on to the next thing that I wanted to discuss. So I was thinking, well, I've got a few minutes just to kind of introduce the topic and the slides, introduce the topics. And I thought, rather than try and compress too much, I thought when I was kind of, you know, this is campus age, you know, you're 18, you know, 16 to 25, and then, you know, even up, I know there's people that have kind of coming, you know, the other group beyond campus, but, you know, when you're young. So I was thinking, when I was 18, what did I wish I knew about depression. Like, I'm a doctor, I probably starting medical school, but I knew very little about mental health issues and about depression. So these are kind of just some very much key thoughts that I had, but we'll delve into specific topics as we go along. So the first thing is about awareness, when I was thinking, I wish I knew what to look out for. What are we talking about now? I think nowadays, people are a lot more informed, a lot more information around mental health issues, about depression, and I think that's a really positive thing. Um, I sound like an old uncle and say back in the day, and I'll just look at Sarah because she's probably everyone else is quite young, but back in the day, we probably didn't. There wasn't much discussion about mental health issues or about depression. Um, there was just something that person's a wee bit odd or a bit funny, and people didn't really have the words or the language to understand what that was. So, I guess the first three things I wish somebody had told me was in the category of awareness, of knowledge around what to look out for. Now, one thing that we'll talk a bit about is there's a difference between being sad or miserable or down and being depressed. And so people used to say clinical depression, and what they really mean is when does it become like a disorder, something that reaches a threshold where it becomes a problem with your functioning, with your day-to-day life. And we'll maybe talk about some of these symptoms, but there's a difference because some people will say there's no such thing as depression because everybody gets sad, that's normal, and that is true. So there is a distinction when we're talking from a medical or a psychological perspective between being sad and miserable, which is a normal human emotion. We're not saying we'd want to medicalize everything, and that is one of the criticisms that people say generally in terms of mental health issues. Everything's becoming pathologized, everything's becoming a disorder, when something bad or sad happens. So there is a distinction between being down, being sad, and being depressed. Okay, and we'll talk a bit about that. I think it's really, really key to understand that depression is a treatable illness. Um, People sometimes, before the 1950s, people used to, there was not many treatments, there's lots of things that were being experimented in terms of medications, in terms of psychological therapies, but particularly since the 1950s and 60s with the introduction of medications and certain psychological therapies and what we call evidence-based medicine, there are treatments that we know work, and that includes medication, includes psychological therapies, and we'll talk a bit about that. But it's not kind of something that is untreatable, and I think that's really, really important to remember, is that you can get help and you can get better. Okay. And the third is a really important key thing for in life that I, probably became aware of more later on in my life is about, become aware about yourself, about your behaviors, your habits, your personality. Because the more you understand about yourself, the more you're sensitive to emotions, feelings, your thoughts, then it's something that you might recognize, but also you might recognize in others and be able to help people. And I think that will just generally help you in life. So I guess a lot of this talk is based on either things that you might be going through, but also people around you might be going through, and how you can help them. Um, so I think becoming more self-aware about your mental health, about your personality, about the way that you think, the way you cope. Are you an angry person? Are you an introvert? Are you an extrovert? Do you like being around other people? Do you get really anxious around other people? So just generally, that's a really important factor. The second next three categories is more about your response. Like, what do you do about it? How do you manage if you do recognize some of these difficulties? And I think that's the other thing is that what once you've identified, once you're aware of having certain issues, what do you do about it, or what do you do for somebody else? And I think a really key kind of life lesson for me is that you can't, and even our faith teaches us, we see this, and we can see it from the Sirah and the Prophet's example, peace be upon him, is that you cannot control life events, but you can control how you respond to these events in your life. Okay. So there are some things you can control, but you can't control everything. So, things like, bereavement, maybe things like trauma, particularly in childhood. There might be other things that you've experienced that are out with your control. Some people are going through, natural disasters, so in Libya, we saw in Morocco, earthquakes. these are things that are out within individuals' control. But how you respond to it is what you can control. The same in life, in relationships, in your education, with work. With the pandemic, we saw we didn't have any control of, this virus that came out of nowhere, really, for a lot of us to that scale. But how you responded is what you can control, and that's an important part of life. The other aspect is there's a difference between deliberate self-harm and suicide, okay, or suicidal ideation. And that's another distinction. I guess people, and myself included, used to think, well, it's just the same thing. If you want to harm yourself, you want to end your life. And again, that's something sensitive that we'll talk about. And it can be related usually to depression, but not always. And we'll maybe touch upon that as well. But part of the treatment and the approach, both in terms of factors that lead people to have mental health problems, but also what is part of the treatment, is not one thing. It's what we call multifactorial. There's usually a number of different things that will help. Um, and I think I tend to break it down for people into four main areas. Biological things, so that could be things like medication, other kind of what we call physical treatments. There could be psychological treatments, so you might have heard of things like CBT, cognitive behavioral therapy, other types of therapy. It's social, so it's addressing underlying issues. You might have problems with your housing or marital problems, or there could be you're in debt, or you're quite isolated, or quite lonely. These are other things too that you could work on. And for us as Muslims, it's spiritual as well. What are the things that we can do to enhance our mental health? And that's through Quran, dhikr, our faith in Allah as well, which is really important. Um, and the third area, particularly for this audience, is about faith. And there's some key messages that are really, really, important to emphasize. So, there was a big campaign within psychiatry for over a number, of years and decades to say, you know, your mental health is just as important as physical health. Yeah. And now we actually recognize sometimes people say it's even more important, but there's kind of that, they're equally difficult. Um, so one is that your mental health problems, are just as serious as your physical health problems. But when you become, if you have depression, it's not because you're not a good enough Muslim or you're a bad person. I have, I've seen plenty of very, very religious people who have been afflicted by depression. And conversely, I've seen people, not everyone that's, an atheist, you know, um, does, necessarily gets depression either, so it's it doesn't correlate. So it's not because you're not praying in that, and I think that's one of the issues that maybe people don't really understand. Mental health issues will say, well, you're not praying enough, or you're not a good enough Muslim, or you did this thing bad in the past and this is like your recompense for that. It's not. When you become, from a medical perspective, when it's not because you're not a good Muslim, and I think that's really, really important. Now, one of the issues in depression, which we'll talk about a bit about, is your thoughts change, your thinking changes, and you might start believing you're a terrible person. You might start believing you're a bad Muslim, and that's your illness talking, really, rather than the reality. Um, Especially for many of us that are from kind of the Indian subcontinent and Africa, etc. There's a massive overlap with people think, well, if there's something funny about this person in terms of their behavior, they're just spending all their time in bed, or they're talking quite negatively, or maybe they're hearing things, hearing voices, then it must be jinn that's possessed them, or it's magic or it's evil eye. Now, clearly within Islam, we believe in, some of these aspects. But I think the more I speak to religious scholars, the more I speak to psychiatrists, almost over 95% of the time, I would say, is, fits within a pattern of a mental disorder. If, and maybe less than 5%, maybe, even less than that, could be something else that doesn't really fit into the pattern of a mental disorder. So I think our community usually flips it and thinks, well, it must be 95%, jinn or jadoo or sihr, things like that. Now, the issue why that becomes important is that if your brother or your sister or your daughter or your mum or dad have those difficulties, people take them to the imam rather than take them to the GP or the doctor. And they go to the imam, and you get dodgy clerics and you get good ones. And good ones will usually say, well, go and see your doctor to make sure there's nothing else physical going on. But other people might say, well, actually, stop your medication, or, this has happened. They can misdiagnose, and that causes more issues. Some people, it's a financial, benefit they get out of it as well. So you need to be careful about that. And at the end of the day, despite everything, I think one of the other things is with any illness or when any kind of health problems is, remembering that this is a test from Allah subhanahu wa ta'ala, that we are sent to this world to be tested, even if you look at the seerah, the Prophet's life, and all the prophets and and the Sahaba, it was test after test. So I think if we come to the realization, if we at an early stage, realizing that life is a test, you will face difficulties. Life sometimes isn't fair. That this is a means of getting closer to Allah subhanahu wa ta'ala, and this is maybe a way of kind of cleansing your sins, or bringing yourself closer to Allah. Because if you put the Prophet, peace be upon him, his most beloved, through test and hardship, the loss of his sons, etc., then that's almost the norm. So I think sometimes people think, well, life should be fair, life should be easy, and when it's bad things happen, they crumble because they can't face it. But as Muslims, we realize these things can happen. It doesn't make it any easier, doesn't make it's fine, but it helps you contextualize. There's a long game here, isn't it? Our ultimate aim is Jannah. So that this temporary difficulty or suffering, whether it's physical illnesses, whether it's other challenges or mental health issues, is ultimately, inshallah, we believe that will give us reward and give us success in the hereafter if we're patient and have sabr. So that's kind of the main kind of 7 points, or the 8 points, that I think as an introduction is my kind of initial reflections. Now, as I said, I don't want to make it into too much of a lecture, and slightly a bit more informal as well. So I think me and Sarah are going to have a bit of a conversation. She's got a number of questions, and if people do have questions, I've got a number of slides from some previous presentations, so I might jump across because I think there's some kind of good visual aids that I'd like to show you if there are certain topics that come up. So hope that's been okay as an introduction. Over to you, Sarah.
Yeah, Jazakallahu khair. I think that's a really nice way of starting, actually. What I wish someone told me when I was younger, because there wasn't really a language for mental health illness when we were younger at all. So it's been a steep learning curve for us. And it's good that we're talking about these things much more. So welcome all of you. This session particularly is for the campus age and beyond campus, but you're all welcome. So please do stay. But what we will do is, if we could, please prioritize questions from the campus and beyond campus age group first. And then if those are dealt with, anyone else can ask. So if you could just bear with us, please. So my first question is, how would you define depression? Because you talked about being sad and miserable. So what is depression, and how would you define it, please?
Yeah. So I'll jump to I'll talk through maybe a few slides that I've got on that topic. So one is in terms of, I think particularly for this young age group, is recognizing when to look out for things, when do things start. So in terms of most mental health disorders, we know that about half of all mental health disorders start in your teenage years. So I think that's something really important. So it's something that starts when you're younger. So many of you might have that's kind of a vulnerable time, because there's a whole host of different reasons, but that could be it's a time of transition, etc. We'll talk a bit about some of the causes. But in terms of the symptoms, when we talk about depression, one of the main differences between just having a sad day or a bad day versus depression is that the difficulties that you're having are usually go on for at least a couple of weeks. So most days for at least 2 weeks, if not longer. So it's usually weeks and months. So if you don't do well in your if you fail your driving test, for example, and you feel sad for 3 or 4 days, we wouldn't really classify that as depression, okay? Or you lose your job, or you don't do well in an exam. That's, I guess, a normal human response. It's okay to be sad when things haven't gone your way. What we usually talk about is when depression develops, it's something that will go on for at least a few weeks, if not months, you know, so it starts gradually, then it builds up and it builds up. And the core symptoms is kind of having a low mood. So it's feeling quite sad, feeling quite down. You can also feel that you've got no energy, so you're lacking in energy. So you might be spending more time in bed. You might be just fatigued all the time. You have to go back to sleep. You don't want to really do things. You know, you start missing your lectures. You start kind of turning up late at work. And one of the other core features is you kind of lose interest in things, and lose kind of the enjoyment. So you know, we use the term anhedonia. So anhedonia, amotivation. So you know, things like you lack motivation with the reduced energy, but you lose interest in things. So you know, you might really enjoy kind of getting through your Netflix series, or you might enjoy your sports, or reading Quran, or going to your circles. And you kind of you know, you're playing your video games and you just stop enjoying them. You know, you don't, you know, stop socialite. You don't really enjoy going to the cinema, so you end up you know, avoiding these things. And the difficulty, and I guess linked with the Simpsons cartoon, is because the difference in physical and mental health issues is physical, you can't really see it and you can't really do a test for, you know, things like depression. There's not a single blood test and you say, oh, you're depressed. It's kind of a constellation of, you know, symptoms that we look for. So it's clusters of symptoms. Now, where that becomes difficult is that if you're a family member or you're a friend and you don't really understand mental health issues, people will say you're just being lazy. You know, you're just spending time in bed, you're avoiding doing things, you're late for your lectures, and you're just miserable, you're a bit moody, and you've been like that for the last month or two. Well, rather than them thinking, okay, this might be a, you know, clinical disorder, this could be depression, people will say, just pull your socks up, you know, just, you know, sort yourself out. You should be able to do it. And then that gets into that, you know, cycle where it makes the person often feel even worse because they think, well, actually, you know, I'm failing at things, or I'm a burden on other people. So the kind of core symptoms are important. There's kind of your thoughts change and your body changes. So in terms of your thoughts, which is really important, is that you can start getting very what we call negative thoughts, and they become quite pervasive. So you might feel guilty, you know, I'm a bad son, I'm a bad husband, I'm a bad wife, I'm a bad person because, you know, I'm not helping out around the house, or I'm not really doing things. You might become quite pessimistic and hopeless, or quite worthless as well. So, you know, you feel you know, you don't pass your driving test. And most people will say, okay, maybe you just need to work harder, more practice, let's get back onto it and let's kind of fit it again. But if that kind of spirals into, you know, if you're depressed, people say it's like if you imagine sunglasses that you put on and all you see is the negative, then you can say, well, actually, I'm just useless. I'm a terrible person. I'm no good at anything. You can really kind of put yourself down. And what they say in what happens in depression, usually when you're well, you know, something happens and almost instinctively or automatically, your mind kind of weighs up the good and the bad and thinks, okay, things are okay. So if you're walking down the street and somebody you know doesn't say salam, or you know, doesn't see you, you know, when you're feeling well, you might just say, well, they didn't see me. Maybe they were busy and they were in a rush. Maybe there's some other excuse. No big deal. You know, and don't take anything from that. You know, and just get on with your day. If you're depressed, you know, if somebody doesn't say salam to you, you'll say, well, you know, maybe they think you know, I'm not a good person. Maybe they really dislike me. Maybe, you know, they think I'm a bit, you know, disheveled, or, you know, they don't like the look of me. And so you'll turn that same scenario into a very negative thing, and you'll kind of internalize it to yourself and kind of almost beat yourself up with it. So your thoughts become very negative. You know, you might say, well, there's no point me carrying on with uni because I'm just useless, and I'm never going to get a job, and I'm never going to be a success, or, you know, nothing's going to work out for me. And that, you know, sometimes when, particularly in kind of a severe depression, it leads to the stage where sometimes you feel actually life's not worth living. You know, the pain, the distress, these things are too difficult, and that leads to you having, you know, either suicidal thoughts or thoughts of self-harm. And I guess it's worthwhile just talking a little bit around what the difference is there, and we'll come back onto it. So people self-harm for well, I guess the technical term people use, deliberate self-harm. People self-harm for a whole host of different reasons, and it's not necessarily to end their life or they don't feel life is unbearable. Sometimes people, deliberate self-harm can be a coping mechanism. Now, we all develop our own different kind of coping mechanisms. When you get stressed, when you get anxious, when things are not going so well. Now you have positive coping mechanisms. So a positive one is, look, I'm stressed, I need to go to the gym, or I need to go meet my friends, or I'm going to go and just watch a movie and just watch Netflix, and that's kind of your coping mechanism. But some people develop kind of unhealthy coping mechanisms. And so that can be taking drink or taking drugs to kind of blank out what they're feeling. Some people start self-harming. And that could be, usually starts in their teenage years, where they could maybe self-harm by cutting or, sometimes taking overdoses or sometimes burning themselves with things. It's kind of quite inflicting that bit of pain. And, these things are quite complex, but there's no intention to end their life. But it's a way of coping and, relieving distress or introducing a bit of control to their lives. When people become depressed, they can feel life's not worth living, and that's where they can become suicidal. And it can involve thoughts of feeling, actually, I'm a terrible person, life's not worth living, or the pain is unbearable. But also what happens with the negative thoughts is almost it becomes something quite altruistic. They actually think, well, actually, I'm such a bad person, I'm a bad husband, or I'm a bad son. Maybe the family would, I'm a burden on the family, maybe they'd be better off without me. But it actually comes from a place of, actually, I want to just, it'll be do somebody else a favor if I'm not here so that they can get on with their lives. So there can be a whole host of different reasons which are really important to understand. But there's, there's help available, and, suicide is something that, there's lots of ways of managing that. And I've got some slides around the aspect of, what we can do around that. So that just gives you a flavor. When people's thinking becomes quite changed or quite altered, it does also link in with the kind of thoughts of self-harm. And the other thing is the physical changes. So we've spoken about the core symptoms, spoken about your thoughts change, but your physical behaviors can change. So you can maybe sleep too much or not sleep enough. Usually when you're very depressed, you lose your appetite and you might lose weight because you think, actually, I don't enjoy my food anymore. I just can't be bothered eating. You can kind of start getting up in the morning really, really early, or something what we call diurnal mood variation, is that you can have dips throughout the day where your moods can dip. Your sex drive can get reduced. So these are kind of different features. So when you go to your doctors, you speak to a mental health professional, they'll be looking at this and just trying to piece some of this all together to say, well, actually, there's enough of this going on to, suggest that this is a depressive picture. It's not just taking one of these individually. Just because you're not sleeping doesn't mean you're depressed. But it's a cluster of symptoms that are happening, and then at least it's happening to such an extent where it's kind of interfering with your kind of quality of life.
Thank you, Jazakallah khair. So it was really clear there that we all might have fluctuations in mood, but it's that consistency of 2 weeks or more of these symptoms that you've described. And it could be some of them, but there'll be a pattern there and a cluster that a doctor would assess. So you mentioned earlier about how young people are so predisposed to mental health illness. You didn't mention necessarily depression, but I think that's why it was so important to have this session for our youngsters, because there is so much brain development going on. There's so many changes going on as well. So it'd be really, really useful for you all to be able to sort of look at this and sort of be able to care for yourself, but also for a loved one or a friend. Let's say you're going away to uni and you notice a change in your friend. How could you support them? So we'll come on to that a bit later. So thank you for describing sort of, I suppose, what we describe as the signs and the symptoms, really, of a consistent low mood or depression. Could you, actually, before we go on to the second question, what we thought was on this topic, if there's any questions, we can take questions as we go along. So on the topic of the symptoms of depression, how does it look, as it were? Are there any questions from the audience at all? If we could prioritize the youngsters sort of campus and beyond campus age. If you just put your hand up or type something in the chat, with each question, we'll open it up, take 2 or 3 questions, and then go back to the sort of interview style that we're doing here. So would anyone like to put their hand up and ask a question, or put it in the chat? Sophia and Yusuf, you might need to look and see if anyone's got their hands up. I can't see everyone at the same time. Just give it a few seconds.
Yeah, we have a question from Afnan.
Okay, Afnan, if you'd like to unmute.
Yeah, Assalamu alaikum. I'm not sure if you had already mentioned it, but there was a lot of information there. So I just wanted to check, can it be caused by, say, if you have an illness, like, I don't know, like eczema or asthma or something chronic that affects your sort of daily life, can that also be a trigger for this, or is it considered separate?
Yep, that's a really good question, and this probably leads me on to what so I guess the causes of depression is really important. And I'll put this slide. So it's a bit of a busy slide, but essentially, what's some of the causes of depression? Now,
Aman, your speaker's just gone a little bit, it's just glitching a little bit just now. It wasn't before.
Okay. How is that? Is that any better?
Yeah, much better.
Okay,
thank you.
sorry. So let me just try and get my wee pointer here. Can you see the wee pointer? Is that on the screen? Yeah. So no, thank you, Afnan. So it's a really good question in terms of what's the causes. Usually there's multiple causes, so for everyone it's different, and I guess part of the job of the doctor or the healthcare professional is to kind of it's a bit like detective work. It's working out for you or for that individual what caused that depression. And usually there's kind of 3 or 4 main areas. So I've kind of written it here. Kind of, we know depression is more common in females, but it obviously does happen in men, and we know men are particularly bad at talking about their emotions and feelings. So that's something important. So there can be genetic factors. So if there's a strong family history, if your parents have got depression, so, you know, sometimes it runs very much in families. You know, there's lots of people have depression. And sometimes it can just come out of the blue then, because it's very much a biological or genetic thing that just, you know, happens. But usually in more people than not, there can be sometimes kind of this genetic factors, but usually there's environmental things. There might be circumstances that kind of are also really important. We know that, your kind of experiences when you grow up can also add a bit more vulnerability to becoming depressed as well. So your experience, the way we are as adults, is very much based on our past experiences. So when you're growing up, if you're growing up in a household with some marital issues or domestic abuse or physical abuse, people have experienced that. If there's poverty, if there's kind of racism, Islamophobia, we know that this social context is really important as well in the environment you grow up. And I guess that links into this third point about childhood experiences, particularly if you've had difficult childhood experiences. What all these things do, they add kind of to the vulnerability of you developing kind of a mental health illness. And if you have a lot of vulnerability to that, it's like if you imagine your body or your mind is a lot more sensitive to, to becoming unwell. It doesn't take as much of a stress to tip you over, whereas somebody who doesn't have many of these kind of, vulnerability factors maybe needs a bigger stress to make them from being well to unwell. But physical illness is one of them, and that's really important. We know that's a really important factor. So there are particular things. So if you suspect you have depression, one of the first things we would say is get your GP to check certain bloods. So for example, we know depression can be very much solely linked sometimes to things like anemia, for example, thyroid problems, which is a gland, in your neck. Sometimes other medications, if you're taking certain medications that, particularly in women, sometimes if you take hormonal medications, it can sometimes predispose them. If you take steroids for things like asthma, sometimes that can cause mental health difficulties. So absolutely, I think you need to get your physical health checked as well, because if that is a primary cause, then the treatment is you treat the underlying physical illness, and then, you know, hopefully the mental health issue will improve as well. So usually that's kind of, there is that interplay between these kind of genetic factors, the environmental factors, your childhood experiences, physical illnesses as well. But I might just touch upon another aspect, which is actually I'll come back to that in terms of adverse kind of childhood experiences, but I'll maybe show this slide, which is linked to, I guess, these vulnerability factors that I talked about. So it's a bit of a complicated, well, hopefully not complicated, but I'll just talk you through it because it helps just to think about any mental illness. Now, if you have these vulnerability factors at the bottom, now you can have low vulnerability factors, so and high vulnerability factors. Now, if you have more vulnerability factors, so that could be things like maybe you've grown up in poverty, maybe you've had difficult childhood experiences, maybe you've got physical health illnesses. Now, the stress, and here's the amount of stress that, you know, that on the Y scale. Now, move to the next slide. So, yeah, so if you get a life event, imagine a life event. So part of this graph helps explain, people when, well, why do two people, it could be in the same family, why do two people experience the same life event and they have two different responses? So, you know, for example, you drop out of uni, okay, you know, you drop out after first year. Now, why does some people, you know, develop kind of a depressive illness, you know, start, you know, spending all time in bed, not doing anything, versus why do some other people decide to set up a business and become a multimillionaire and set up a tech company, you know? Because I think partly it depends on their vulnerability factors. And if you have this person, one who has got these low vulnerability factors, although the stress is the same, it still keeps them in this green zone, which is they still remain well, okay? Whereas if you're somebody, person two, who's got a lot of vulnerability factors, you know, it hasn't taken much to tip them from the green area, which is when they're mentally well, to becoming unwell, which is the white area. And so these kind of vulnerability factors are important, and that's when they're talking about, you know, your self-awareness is important. And one really important thing I take from this kind of model is we've all got our threshold. You see, nobody is immune to going from wellness to illness. You know, it doesn't matter if you're a psychiatrist, doesn't matter if you're a scholar, doesn't matter who you are. Now, for some people, maybe the threshold will be really, really high, and some people it might not be high, and it tips them over. But what we also understand about stress, we talk a lot about stress, and we can talk about, you know, stress has this biological change in the mind in terms of our inflammatory system. It does, you know, cause a lot of change. People used to just think, well, it's a big stress, you know, somebody's died, or so you've been in a earthquake or a war. People thought that was the only types of stresses. What we know now is those stresses are important, but the other kind of stress is chronic stress. So day to day, you know, stress over a period of time is just as damaging. So for example, if you're at school and you're getting bullied, or you're at school, you know, there's bullying day after day after day, or, you know, you are facing physical abuse day after day, or you're in an abusive relationship day after day. You know, it's that chronic stress, or your poverty, or there's racism. That chronic stress over a period can also, you know, build up. So when we're talking about life events or stresses, it might not just be one thing. You might say, well, actually, I can't think of a really big stress that's tipped me over, but it could be lots and lots of changes and stress over a period of time. So that's in terms of the causes, in terms of understanding that. The other thing I would mention is there's also understanding your own kind of thinking patterns, and the way you kind of see the world also kind of can predispose you to developing depression or not. So there's a couple of, you know, experiments that people did. I mean, you can't do these nowadays, but, you know, they used to do lots of wild experiments in the past. So one thing is that there's something called learned helplessness. is that if you keep exposing somebody, what they did in these experiments, they kept giving electric shocks to dogs, and then after a while, the dogs mimicked, or they got depressed. Initially, they would kind of respond or get through, but after it kept going on and on, then they would become depressed. And that can happen in humans. And one of the things, a personal thing where for me that kind of really resonated, I had the opportunity to go to Palestine a number of years ago, and we'd obviously know the oppression and the situation, in Palestine and the oppression. But you saw, I saw fit young men, in their 20s, just totally lose kind of any motivation. They're just hanging about, in streets because they had, all opportunities in their prime were taken away from them. They couldn't travel to work. They were kind of restricted. And it's almost, for me, that actually this concept struck home for me, because over months and years and generationally, they just kind of give up after a while. They get, because I say, for some people, now some people will respond and deal with it in a more positive way and trying to enact change, but there are other people that just kind of, just give up. And that's kind of, it reaches a point where, if you just give up, because you're constantly exposed to that kind of negativity. The other thing is something called the locus of control. And it's your kind of outlook on the world, and I think it's useful to recognize what sort of outlook you have, and also see what can you kind of change that. Now, there's, and also again a busy slide, but if you kind of just focus on this and the diagram, so there's something called the internal locus of control. So, do you feel in a situation that you can control things, you can make a change? Are you kind of somebody who says, look, climate change is happening, I'm going to make a change, I'm going to fight against it, I'm going to do what I can, and you start initiating things, you raise awareness, you do campaigns, for example? Or are you somebody, we call it external locus control, that the whole world happens to you? Whereas if you're internal locus control, you're trying to change things around the world. But if you have this external locus of control, you think, well, there's no point. Recycling is not going to make any difference. There's other governments which are doing this. It's just such a big problem. I give up. I'm not going to do it. Or you're constantly this victim mentality. Oh well, it's just all. There's no point me trying to do anything because there's no hope. There's no aspiration. And what we know is that people that feel more helpless or hopeless, that have this external locus of control, they're actually more likely to be depressed. So if you're somebody who thinks, oh, well, I can't make any change, or the whole, the government, everything is just stacked up against me, there's no point doing anything about my future, about this, or, if you don't do well in an exam, for example, like, so I don't know, we're doctors, right? I've met plenty of doctors, and they don't do well in like their job, and some will say, first drop a hat, oh, it's racism. It's just totally racism. Now we know racism exists in the NHS, and it's very much there. But you also say, actually, you were, you're quite lazy. You weren't really doing stuff. You were kind of just never about. You weren't really putting the work in either. So there's a fine balance, but there are some people that just, have certain outlooks on life. So I guess what I'm saying is recognizing how you see the world is really important. And if you have this external locus of control, you're more likely to be depressed. Now, one of the real examples of this is, many of you will be aware of this very famous person, Viktor Frankl, and he's got this fascinating book called Man's Search for Meaning. And he was an Austrian psychiatrist, and he's a Holocaust survivor, and he was kind of 3 years in like 4 different concentration camps, including Auschwitz. His family were murdered, and in his book he writes about his experiences. He was a psychiatrist, so he was observing other people that were in the concentration camps during the Second World War. And what he noticed was that there were some people that came and just gave up, and he goes, they didn't really survive, they didn't last long. But there were people that found little things that could keep them going. And it was that idea of, you know, they couldn't control their situation. They couldn't control, you know, they were they were all in the same situation in terms of being in the concentration camps, but the attitudes and responses differed. And the people that chose to try and make changes or find meaning or find something positive to keep them going were more likely to kind of have a better outcome and survive. So he's got a very famous quote: "Everything can be taken from a man but one thing, the last of the human freedoms, to choose one's attitude in any given set of circumstances, to choose one's own way." Despite, you know, there are such times when you are not, you know, you can't control what's happening around you, but you can control your outlook on life, how you're going to deal with it. And we know from, you know, even our own seerah that, you know, you know, one of the great, you know, things about hope and aspiration. We know in one of the battles where, you know, the Muslims were really, you know, on the back foot, and you know, we know that when the Sahaba were digging, and the prophets then prophesied that I can see, you know, the opening up of these far lands, that we will be successful. And you know, you know, people were questioning, well, actually, you know, we're in this battle, we're really on the back foot here. But you know, the Prophet, peace be upon him, was hopeful, was, you know, looking forward, and he had hope, and that's important for yourselves, but in terms of sharing that with other people as well. So hand back to you, Sarah. Sorry, but I think these are kind of important in terms of how we think about what things predispose people to maybe getting depressed.
Yeah, thank you. So we've done quite a bit, covered quite a bit actually. So Afnan's question, absolutely, you know, chronic health diseases is something that we always check for how people are mentally, you know, and that could be something like, you know, high blood pressure or diabetes, eczema, asthma, including, you know, more serious conditions like end of life conditions as well. So and thank you for going into a little bit more about sort of outlook and protective factors. I think, you know, you touched on it with the adverse childhood events, and there's so many things that are not within our control, like living in a war zone or living in poverty or losing a parent or having trauma within the house. I was just wondering whether you could talk a little bit about what might be the contributing factors amongst young Muslims in particular. So you've spoken a bit about age and the predisposition of age to mental illness. I wonder if you could talk a bit about faith. There is this idea of generational trauma. You know, many of us are the children of immigrants, immigration, racism, Islamophobia, poverty, which is also linked in the indices now. Is there, could you talk a little bit about what might be the specific contributing factors towards depression amongst young Muslims, please?
Yeah. So I think it's tricky, because I think there's in terms of there's probably, and you know, what from our experiences, what we know, and probably in terms of what the evidence is and research shows, and I guess there is research there, but it's kind of, you know, it's an area that could do with more research in these areas. I think one professor I worked with, when he talked about particularly around mental health issues, particularly things like psychosis, etc., what he felt was one of the key things is what we call kind of how socially dislocated do you feel from your society around you. Yeah. So just to elaborate on that, so I guess his theory, which I think, you know, I can agree in many ways, is that if you feel, you know, disconnected or dislocated from people around you, both in terms of your family, your community, and society, then you're more likely to develop mental health difficulties, I think. Now, just to elaborate on that a wee bit, so, you know, we know that we're social beings, you know, if you think, you know, from an evolutionary perspective, you know, we're social beings. You know, the famous African proverb, you know, takes a village to raise a child. You know, we're supposed to be growing up in communities, with families and communities. Now, there's a number of factors which we face now, particularly if you think about young Muslims in the UK, for example. As you said, a lot of us are from immigrant backgrounds, so you know, our parents or grandparents came from abroad. Now, you know, that experience in itself was, you know, particularly challenging experience, But what that has led to then is a real question of identity, I think, difficulties. And for each generation, it's actually changed. For our generation, maybe, growing up, a few decades ago to 80s and 90s was different than the 70s and 60s. Some people say the immigrant journey, like the first generation, when they come, it's all about survival. It's about, making enough money. And most of, our grandparents and parents, their plan was to go home after a few years, So that was their idea was, let's make some money, let's go home. It's very famous, we only came for 5 years, and then, 30, 40 years later, it's still there. Then kind of the next generation after that, and remember that generation probably didn't speak much English. Our migration patterns to the UK are very different to even if you look at America. The American pattern in the 50s and 60s, most people that went to America were educated, were kind of going there for scholarships, whereas most of the migrants that came to the UK were very much after the war. It was for manual labor, it was to work in the textiles and mills, etc. So the migration patterns have been very different. So I think what that means then as us as a community for young Muslims, particularly with descendants from other countries, is that for our first generation probably didn't speak much English. Most of them, it was about survival. And then subsequent generations, it's been a bit about identity as well. Growing up, well, how do I balance being a Muslim, in my case being a Pakistani and being British, and that real interface and that battle is incredibly difficult now. Part of being a teenager, part of being a young Muslim, a young person anyway, is you're navigating lots of different transitions. You're going from being a child who's dependent on your parents to become an adult where you don't want your parents to come with you, when they drop you off at, the shops or things like that. You want to become your own person, but you're kind of, when you're a teenager, you're stuck in between the two usually because you want to be independent, but you're still really dependent on your parents mostly, you're still financially independent to some extent. So that's a difficulty. Now, add on to that is all of the challenges young Muslims face with going to school or going to university. When I started university, Freshers Week was all about alcohol, especially in Scotland, in Glasgow. So everything was, and medics was all cheese and wine functions, So straight away, you can imagine that I was lucky that I went to Glasgow University, brought up in Glasgow, so wasn't so much of a transition. Now, I knew people that had come from out of city now, that feed into that, feeling quite lonely, isolated, feeling maybe a bit uncomfortable if you've not really grown up around gatherings where there's alcohol. Now, you might be lucky that you have some other, I was lucky I had a lot of Muslims in my year, and we got on quite well, so that was quite fortunate. But there were other years where there's only 1 or 2 Muslims. So how do you kind of connect with people? How do you kind of socialize? It's really hard, as a student, young person, to just be steadfast and stay on your own and isolate yourself from everything else that's going on. So I think that's a particularly difficult transition. Now you go to the workplace. You start working in a big bank, or you start working, a corporate environment. Again, it's very similar issues that, are you more likely to progress more in your career if they know you better? Now, if you're not going to the social events where there's alcohol, where there's other things going on, going to the Christmas party, again, so you can always feel a bit of an outsider. So there's all of these issues, I think, going on for Muslims, young Muslim. Now, it's less so of language because we all speak the language, but now it's these interfaces where your faith can be in conflict with what's going on around you, and that battle, which is normal to some extent, can be really hard for some people. Now, add on to that your other vulnerability factors, add on to that, do you have other friends or family, etc., and how you navigate that. So I think these are particular issues for young Muslims. Now, I think things have changed a lot from our days, and a lot of positivities, like most workplaces, and I think that's a mark of progress as a society. I've never had any difficulty when I've had to pray at work. people are quite understanding. Actually, they'll kind of overcompensate. You know, a lot of places will have Jummah facilities, will give you time for Jummah. Halal food is everywhere. You know, these, I guess these are just very much kind of proxies. But part of it is how do you, is there a sense of belonging at university or at work or in other situations? If you don't have this sense of belonging, then you might grow up feeling, well, again, this idea of this social dislocation, not feeling connected to what's happening around you. And that, I think, is incredibly stressful for, people, and predisposing them to, potentially mental health issues and depression if you're not careful. So, as with all of these, it's not just one factor. You kind of have to, I always tell patients, it's like an iceberg. When you come and see me, with feeling quite anxious or feeling quite depressed, that's the tip of the iceberg that you can see above the water. Our job is to uncover what's the bit under the water. So what's your past experiences like? What was your childhood like? Were you quite socially isolated? Have you got any other kind of mental health issues? Have you got physical health issues? How do you kind of see the world? How do you kind of, plan for the future? So everyone's different, and it's a bit about piecing these things together. But these are kind of some of the broad things that we would look for.
Yeah, no, thank you very much. Thank you. I think that's been really enlightening. Let's open it up for a little while. Does anyone have a question in the audience at all? If you do, please put your hand up, or you can put a question in the chat. I have one that's been submitted. I'll just wait and see on the themes that have been discussed so far, whether there's any questions, because we have more to get through. There will be an open Q&A from about 9:15 onwards till 9:30. Sophia, are there any questions, any hands up at all?
No, I don't think so.
Okay, so if I can ask the one that's been submitted, could you maybe just speak a little bit, because we don't want to go into manic depression, but how you might be able to tell the difference between depression and manic depression. If you could just answer that in a concise way, and then we'll move on. Is that okay?
Yep, sure. So when you talk about manic depression, it's got a number of different terms. So the other term, I guess, we use a lot is something called bipolar disorder. What that usually means is that when we talk about mood disorders, there's a number of different kind of mood disorders. You can have depression, which is kind of low mood and all the things that we talked about. Some people, their mood can swing the other way, where they can get high or manic. And what we mean by that is they can, for example, feel quite elated in their mood, quite euphoric for long, for periods of time, or they can get very irritable as well. So you kind of have this period where you're either really irritable with people, your mood's elated, but you can, it's almost, if you imagine your mind and your body, normally operating at 100%, you were operating at 200 or 300%. So your thoughts are racing, you're overactive, you're restless, you're agitated, you can't sleep. Now, some people, you can be actually quite productive. If there's famous psychiatrists that have talked about their kind of mania during their manic episodes, they're writing loads of research papers because they're not sleeping. They're just making grand plans. I'm going to open up this business, I'm doing this. So your body's kind of just in a very hyper state, and that's what we tend to kind of call a manic episode. Now, if you have depressive episodes and manic episodes, then your moods can kind of fluctuate. So if you're having these different type of mood disorders, that's what we then call bipolar disorder, or used to be called manic depression. And so that's something also to recognize. If you are getting these kind of manic episodes, then you might have a kind of bipolar disorder. And there's a slightly different kind of, it's usually can be a lot more genetic in nature, and also the treatments are slightly different in terms of managing that, in terms of medication, psychological therapies.
Yeah, thank you. Because I think it's particularly underdiagnosed, because often, I mean, that's a lesson for doctors to ask about the other side of it. Often we sort of zoom into the negative, the low mood, and not the other side of the coin. Sometimes we do miss that. Okay, so if there's no questions,
we have a question from someone in the audience, actually.
Thank you, Sophia. If you'd like to unmute and ask.
Yeah, hi, Slav. I'm sorry, I got my work ID in. Can you hear me?
Yep.
Yeah?
Yes, we can.
Okay, good. I just had a couple of questions. where does anxiety fit in? Is it like classified as a mood disorder or is it depression? And the other question I had was in terms of, you know, depression, I guess it's episodic. I mean, do you have, I mean, is it this kind of depression? How many days a month? Do you have this kind of low mood kind of thing that it gets categorized as depression, or is there some kind of criteria around that? Yeah,
Oh,
those two really.
if I could interrupt there. So you may have missed the beginning. So what we'll do is we have got this recorded, so we can share the recording later. So Dr. Aman Durrani did go through that right at the beginning. So he was talking about 2 weeks of symptoms, and then he did go into the symptoms. I'm sorry you missed the beginning. In terms of anxiety, would it be okay if we hold fire on that? It's just that in itself is another circle of its own. I don't know if Dr. Durrani, you want to just maybe speak about it for a few minutes, but if we could then move on depression. And the questions that you asked, brother, were very relevant, and I will share the recording, inshallah.
Yeah.
Great, thank you.
Yeah, no, it's a good question. So in terms of anxiety, it's a good question because there's a few things. So one is a lot of mental health disorders will present initially with anxiety. So that could be depression, psychosis, etc. So anxiety is kind of almost an entry point, to other mental health disorders. So it's good to kind of recognize that. There's a big overlap between depression and anxiety. And so what we call comorbidity, you can have both. But a lot of kind of when you get depressed and anxious, there is that kind of overlap, and anxiety is kind of considered like a mood disorder, or like what we call a neurotic disorder. Anxiety, when we talk about it, there's so many different types of anxiety as well. You can have generalized anxiety, you can have phobia. So, but generally that feeling of kind of feeling panicky and anxious can be a feature with depression. And in terms of length of period, yeah, usually it's at least kind of two, most of the time for at least 2 weeks, if not longer. Some people will have, I think it is important to say, like some people will have, an episode of depression, get treatment and get better. But you're likely to have further episodes as well. So that's where medication or psychological therapies can help reduce the risk of having further episodes. So one way of looking at it is looking at it as if it's kind of a long-term kind of health condition for some people. So like you have diabetes or you have hypertension, it's how do you manage it over a long period of time? Because if you have a lot of other life stresses, it might make you depressed again. So it's a good point that you can have further episodes as well. So and some people just develop this kind of chronic depression, what we call dysthymia as well. So again, it can have different flavors and to it as well.
We have another question from someone in the audience that I got via chat. So how much does lifestyle play in mental health and depression? For example, staying up late, playing online games, sleeping till late in the afternoon, normal sleeping patterns, getting more daylight, going for walks, etc.
Yeah, it's a good question. So I think sometimes the challenge again is a bit that kind of chicken and the egg, really, a wee bit. So I think these things in themselves don't necessarily, lead to depression. So if you like staying, I mean, most doctors will be used to staying up late because you night shift and not getting much sleep, etc. So it doesn't necessarily lead to depression or playing a lot of games and stuff. I mean, there is a recognition about other factors that can impact on your mental health. So we know social media is a massive one. But it's again, we like to think of it quite black and white, but it's usually complicated. It's thinking, what does it do? So we know particularly things like Instagram, a lot of social media has benefits, but I guess in terms of the risks and the dangers, if you're already a wee bit insecure about yourself, or you already have some of these negative thoughts about you kind of lack confidence, or you feel quite negative about yourself, social media can kind of perpetuate some of that, in the sense that FOMO, are you not invited to certain things? Is that because people don't like you? So it'll reinforce those negative thoughts. Or, one of the big dangers is comparison, isn't it? I mean, that's the big issue, that you always end up comparing your life to what you see on social media. And we do, as adults, we do that as well. I do that as well. And you really have to check yourself, because it's a bit about, well, that person's traveling on holiday, you know, this person's again on holiday, it looks great, you know, and I'm, you know, struggling financially or work and I can't get away. So it then kind of, you know, it kind of eats, it's like little worms that eat away at you. And again, doing it too much. So you need to just make sure you're monitoring it a wee bit. I mean, I've got a nice slide on social media actually, which again is a whole separate topic, but probably good for this audience, is that so there's a report that was done. This is pre-TikTok. I think TikTok's even worse than everything else, because it's like cocaine for your brain. But anyway, so it's, you know, people in the young people were saying, well, you know, social media increases my anxiety and social anxiety. I'm constantly worried what others think of my posts and pictures. And that's the other way, you know, you might post something that you think is really profound and useful, and you don't get any likes or views, and then you think, oh gosh, am I irrelevant? So if you think about what in this report, if you had more time, I'd ask you about it. But essentially, the conclusion is, out of these social medias, the ones that have the most negative effect on your mental health, so Instagram's the worst, and I think that is because it's very visual, very kind of, you know, that comparison. And then it's Snapchat, then it's Facebook, then it's Twitter. And YouTube was marginally saying that could have some positive effect, and the idea was that you can find good content on YouTube and all algorithms, but maybe there's a wee bit more positivity you can get from that. So we know that on the whole, at least, you know, these 4 platforms, and I suspect TikTok would be on there, is really negative as well, you know, have adversely impact on your mental health. So, you know, there are lots of things from the report. You know, social media has been described as more addictive than cigarettes and alcohol. You know, social media is linked with rates of anxiety, depression, poor sleep. There's obviously cyberbullying. You know, it's that idea that, you know, in the old days, if you got bullied, you know, at school, or you have a hard time at university, you'd come home, you know, you'd get a bit of respite from it overnight. You'd come back to your family and things would be a bit settled. Whereas a cyberbullying's 24/7, you can't switch it off. You know, people are sharing posts about you or your pictures, etc. So, the thing that social media can obviously have an impact as well, on your mental health. So, I think it's an interesting area. There are concerns, there are positives. I think the key message is use it sensibly and know yourself. You know, if it is having an impact on you, then you really need to kind of, you know, I've got very close friends that just delete stuff or delete it for periods, you know, and just they need a break from it. So there's ways of how do you manage it. I think very few people are saying don't have a phone, don't use any online content. It's kind of really impossible these days for many aspects.
Thank you. Yeah, social media is a big one, isn't it? I mean, a lot of our work in campus is advertised on WhatsApp, so it can be WhatsApp, very, very WhatsApp heavy, but there's a lot of goodness in that. And then I know a lot of young people follow a lot of really good reminders and shares now, sort of all at your fingertips on YouTube, which is great. But then there's a negative there as well, in that you can get sound bites that can be quite distorted as well. If we could move on, it's been brilliant. Thank you. So we've talked quite a lot. I think there's a really good, we've developed a good understanding now of what are the signs, what to watch out for, what would worry you about your own health, and your predisposing factors, so that you can really self-care or get the help that you need at the time that you need it. What about helping a loved one or a friend? Let's say lots of you now are going away to colleges or university, or you might work with someone that you have concerns about. How could you support a loved one or a friend in the best way? So what would be the positive things you can do to support someone? What would be the red flags that you'd be really, really concerned about? And what would be the things that you shouldn't really be doing or shouldn't be saying? If you could give us a bit of guidance, please.
Okay. I'll maybe take some of these together, if that's all right, Sarah. So one is in terms of for yourself and for somebody else, you know, you could use some of these questionnaires. Now, I would caution against just Googling anything, but this is a good evidence-based one. You can just Google PHQ-9, or Patient Health Questionnaire. This is something you could do or somebody else would do. And what this is something that is good evidence-based that can maybe pick up whether somebody might have depressive symptoms, and usually what that would do is prompt you to go and speak to your GP or speak to a specialist around that. So that's something that will take you less than 2-3 minutes just to fill in. You add up the scores, and then you kind of get an idea of how severe your depression might be. So in terms of identifying that, so that might be something you or your friend or your loved one could do. In terms of just going back a little bit, in terms of just recognizing what happens in depression, one thing that is really, there's different resources, but one thing that I would encourage is there's a good website called Living Life to the Full, and that's the website. And there's something called in depression, it's understanding what we call the 5 areas approach. And that's what's used in CBT, cognitive behavioral therapy. And so it's kind of understanding what the interplay is. So there's 5 main areas. One is in terms of your environment or your stress. Something happens, you pass, you don't pass your driving test or something like that. Then your thoughts can get affected. So you can get negative thoughts, or you can start worrying and saying, I'm useless, I'm a terrible person. Your behaviors can change, that you start, self-harming, or you start drinking or taking drugs, or start, overeating or doing things that are really just, not good for your health. You can get physical changes, so your sleep, your appetite, can get affected. You're feeling agitated a lot of the time. And your emotions can change. You can have sadness, feel down, or quite anxious. Now, part of kind of what we call a formulation, or pulling it all together, is trying to look at what these connections are. When you're feeling down or depressed or anxious, what's happening to your thoughts, what's happening to your behaviors, what's happening to your physical symptoms, what's happening to your emotions. And this diagram is good because it helps you understand what's going on, but it's also part of the solution as well. Because if you look at these arrows, they're all interconnected and they're all two-way arrows. And why that is important is usually if you start somewhere, it will have a knock-on effect on these other things. Usually the hardest thing to fix first is your thoughts. You can't say somebody, it's really hard to say somebody, just don't stop thinking negatively or stop being depressed. What you can do is maybe saying, well, actually, your behaviors, you're avoiding people, you're not going out. Well, let's start, get out to Juma, or let's go to the mosque once a week, or let's do a bit of exercise, let's go for a walk every day. Or if you're not sleeping, you might do things, what we call sleep hygiene, do things to help improve your sleep. And if you make a start in these areas, you might not feel that you want to do it, might not feel that you don't think it's any immediate benefit, but what happens over time is that it has a knock-on effect on these other things. Your emotions will improve, your thoughts will start, thoughts sometimes change at the end. It's usually the other things get better first. So it's important to kind of understand that. And that's why, people might minimize when people say, well, I'm feeling depressed, and they'll say, look, have you got a bit of a routine? Can you kind of start going for a bit of a walk, do a bit of an exercise, which has got a good evidence base, do some dhikr, read some Quran, go to the mosque once a week, whatever works for you, start somewhere, and then that's likely over time will have a good knock-on effect as well. And I think in terms of the treatment, so the question you're saying, Sarah, is how do you help people? It's going back to that kind of 4 areas that I would kind of mention. So the treatments of depression are usually in 4 domains. And when you see a doctor, you see somebody, they'll kind of say, is this a mild depression? Is it a moderate depression? Is it a severe depression? So you kind of get graded. Now, usually for mild depression, things like kind of self-help books, you might listen to podcasts, you might kind of do a bit of exercise, you might do things, online, a lot of psychological things online. That's usually the best thing. Antidepressants don't usually help for mild depression. So when people read in the news, oh, antidepressants don't help, what they mean is if you're giving antidepressants for mild depression, we know that doesn't really help. But antidepressants for moderate and severe depression do help, and they're very effective. So your options will be, look, thinking again, everyone's going to be different. Biological factors, is medication that you might need to take. Maybe it's fixing your hormonal imbalances, or you get thyroid problems, or whatever, if you have a physical illness, you know, if it's been caused by other medication, sorting that out. The psychological therapy, so it's talking therapy, so that could be counseling, could be cognitive behavioral therapy, could be a whole host of other type of therapies. The social factors, so we're looking at, you know, are you quite isolated if you're at uni? You know, how do you kind of start connecting with people? Is there financial difficulties? Is there racism? Is there housing issues? You know, are you not getting on with your family, or you're married and you might need a bit of marriage therapy? There might be other kind of aspects. And then there's a spiritual, and that could be, you know, Quran, dhikr, connecting with other like-minded people, your Islamic societies. All of these things are really important. But one of the things that I think I really like this kind of example of what's called a resilience jar is we spoke a lot about the causes, about, you know, genetic factors, environmental factors. Now, if you imagine that your mental health and mental well-being is like a jar in the middle, and you've got these genetic factors, which are the yellow circles, yellow balls, and you've got environmental factors happening around you, that's kind of your orange triangles. Now, if you have a lot of, you know, everyone will have a different amount of yellow balls in their jar. Now, if you just have some biological factors, you know, that's fine. It's nowhere near the top. You're just getting on with your life, that's fine. Now, over time, you add on some of these, you know, environmental factors. So, for example, you might have some bereavements, you might have poverty, relationship difficulties, maybe you're unhappy at uni. You know, it's kind of building up. And then once those environmental factors build up to the extent where it's kind of reaching the brim of the jar, that's when you might become unwell. And so that's where, again, it links to that stress vulnerability model we spoke about earlier. If you have fewer of these yellow genetic factors, then you've got more capacity to deal with more environmental factors. If you've got loads of yellow genetic factors of past experiences, predisposing factors, then you might not need so many of the orange things. Now, the way that you kind of recover or you deal with things, so you can't change your genetic factors. You know, if you've had a really difficult abusive childhood, or you've had things in the past, you can't change that. That's there. If you've got family history, that's there. But what you can do is you do two things. One is you kind of deal with your environmental factors, which is your orange triangles. But the other thing is you make your jar bigger. And how do you make your jar bigger? Is what we call resilience factors or protective factors. So actually, if you make your jar bigger, then you can cope with more of these stresses. And how do you make your jar bigger? So that would be around maybe through therapy, through, you know, activity, volunteering, etc. A lot of the kind of things that we will help people. So there's a whole host of kind of specific kind of coping mechanisms that you could do. You know, having a good structure and routine is really important. You know, sleep is really important. You know, you need to sleep well. You know, usually at least 7 to 8 hours. They say teenagers probably need about 10 hours. Exercise is really good for you. It's good evidence-based that, you know, just regular exercise is good. It could be relaxation and mindfulness. You can find all of this in YouTube videos of millions of this places, apps, etc. You know, allow yourself that bit of space to say, okay, I'm going to take a night off. I'm not going to study tonight. You know, you might be studying a really hard course with lots of coursework, but you need to say, it's okay, I need that downtime, or I'm going to go to this social event. Gratefulness, you know, again, there's lots online that you can look for, but kind of we know this gratefulness diary, and Islam teaches us this as well, is that, you know, shukr, you know, sabr and shukr is, you know, important elements, but, you know, every day what you're grateful for, you might be feeling down, depressed, but, you know, you want to thank Allah every day that, okay, I can still see, or I can hear, or I have a nice family around me, or something that, you know, you're grateful for. And that is important to remember, because otherwise your negative thinking will say, well, life's terrible, you know, it's all black and white, it's just either good or bad. Limit your social media, so control it if it's having an impact on you. But also check in with your mental health. So there's some really good, what I would really encourage people, if your mood kind of fluctuates, is keep a mood diary, and you can get apps that do this. So you just put a score, you know, I'm a 5 today, I'm a 2 today. And if you're saying, well, I'm actually really low after 2 or 3 weeks, and you might say, actually, something's not right, I need to change things. if you're finding it's all over the place. And again, when you go and speak to somebody, it can be helpful. Helping others, we know one of the best things for your mental health is actually volunteering and helping others, because it gives you a sense of achievement. It actually gives you purpose. If you don't feel your life's got any purpose or any value, that's going to feed into the negative thoughts. Well, if you think, well, I'm helping with this charity event, I'm helping with the Islamic Society, I'm helping with a food bank, it actually it helps others, but it actually makes you feel good as well. And there's actually a good evidence base, volunteering, taking up a skill, etc. So that's kind of some of the things in terms of how you would cope and manage. I just wanted to mention a bit about suicidal ideation, if that's okay, Sarah. I know we've got kind of a few minutes left, and I thought,
yeah. So
yeah.
if you're all right to do that, and then we do have a question in the chat as well. So if we have time, we'll take that. Yeah. Thank you.
Yeah. So suicide is important, and it's something that I think people find it really hard to talk about. It was recently kind of World Suicide Prevention Day. So the things that you can look out for, or you might experience yourself, that somebody might be having these kind of suicidal thoughts. If they're feeling trapped or a burden, or they get quite hopeless, so very just, they can't see a future. That can be an indicator, and usually they'll talk very badly about themselves. If they've kind of had loss or rejection, so something that's just triggered things recently. There's not always a trigger, but it can be. Sometimes if people, are developing these kind of thoughts of ending their life, they start to make affairs. So they might write a note for somebody or start sorting out their finances, and that might give you a clue. And sometimes what you find, which is really hard, and even professionals find this hard, is that here it says an unexplained improvement in mood, is that sometimes there's anxiety and a build up and tension around having these suicidal thoughts, but once they make a decision that that's what they're going to do, they actually kind of appear a bit brighter, and think actually they're better, whereas actually they might still be a concern. Clearly, if they're not eating, they're not sleeping well, they're doing other risky things, when they're driving, they don't really care if they have an accident, or they're doing a bit reckless stuff, that's another thing to worry about. If they've had a history of kind of self-harming or previous suicide attempts, or if they're acting kind of unpredictably or out of character. So these are things that are important. But there's key messages. Now, there's a really good kind of Muslim website which is being developed by Dr Rania Awad, who many of you will hear. She's a really excellent psychiatrist in Stanford, and she's got lots of amazing content. She's developed she's founded an organization called Maristan, Maristan in the States, and they're doing suicide prevention, and particularly they're encouraging imams and religious leaders to have suicide awareness training and education, do khutbahs on it. So we know generally suicides, can be prevented. Talking about it doesn't make them more suicide. Some people, one of the myths is that if you mention suicide to somebody, they're more likely to, you're going to plant a seed in them. Actually, the evidence is to the contrary. It might actually just open up a conversation. So don't be afraid to talk about it. You're not going to make them more suicidal by mentioning it. There's always hope, so, it's always I remember Imam Siraj Wahaj always saying, suicide is a permanent solution to a temporary state of mind or temporary problem. Usually if you get the right help, things will get better, and we know that. Obviously it can have an impact on other people and communities. Trying to deal with suicide prevention is everyone. We all need to deal with it, both in our families, in terms of religious institutions. And the main thing is just be there for somebody, have that, offer that bit of support for them as well. So these are all kind of key things which, I think a few take-home messages as well.
Jazakallah khair. That was really, really empowering, actually, that knowledge, because I think there's always been this idea that, can I say those words? Can I ask someone that I'm really worried about whether they're having these darkest of thoughts, or will it incite those thoughts within them? And there's no evidence that that's the case. But I think just like we're taught that safeguarding is everyone's responsibility, if you see a child and they're being maltreated and you're on the bus. You don't have to be the teacher or the doctor to notice that something's wrong. Everyone should be checking on our children, and on safeguarding. It's the same way when it comes to suicide, that we all need to be aware, and if we have concerns, we need to be thinking about what we can do. So thank you for touching on that. I think we only have literally 1 minute left. So there's 2 questions in the chat. They're from the same person, so maybe we can take one. But Sophia, there's one that's come to you. So if we tell Dr. Aman the 2 questions, then he can maybe see if he can amalgamate them. So Sophia, if you could read the one that's come to you out.
Sure. So the question is, how do you suggest supporting someone who won't open up to anyone else except you? And how to maybe encourage them to open up to others too?
Okay, and thank you. That's I think Zubair Hussein's asked a few questions. If you don't mind, brother, if we could take this one, just because the audience is a young audience, campus and beyond campus, and that question is particularly relevant. The others, I'm so sorry, we might have to put on a session 2. But if we could dwell on this for the last 1.5 minutes, and then we'll need to close. So that is a crucial question. Sophia, if you could repeat it, please.
Yeah, sure. So the question is, how do you suggest supporting someone who won't open up to anyone except you? And how to maybe encourage them to open up to others too?
Yeah, I think actually if you could just answer that, but also when somebody feels that they are the only one that's being open up to, but it's too much for them, what advice would you give as a friend if it's too much for you to support someone, you can't handle it?
I think that's a really good, and it's probably one of the hardest things that I face as well, particularly in my when I'm not at work, is family members, friends calling you to say, I'm a bit worried about this person, but they won't get help. So in terms of, I think the first thing is just always, just being there for them and keeping that door open. Clearly they trust you enough, or they feel comfortable enough to talk about these really difficult things to you. So I think keeping that door open and keeping that option there for them is really important, that channel for them to let you know how they're feeling, because if they feel entrapped and isolated, then it becomes really hard for them to kind of seek help. I think over time, so the advantage now, there's lots of YouTube stuff, there's lots of kind of online stuff that they might not want to go and see their doctor at this stage, but you could say, check this website out or get this resource. There's kind of that drip effect. If it reaches a stage where they're really at risk to themselves or to others, you need to get professional help, and that needs to be quite quick. So if you're a family member, you might let the GP know. I mean, the part of the complexities is, this patient confidentiality. So if you're an adult, then the doctors are slightly restricted by what they can do if somebody's not asking for help, unless it reaches a stage where they might be at risk to themselves or others, in which case there are mechanisms. And that's where, if it is really severe, clearly if somebody's kind of shutting down, they're talking negatively, they feel life's not worth living, then people can there are mechanisms within organizations through the GP, NHS and others to make sure that person is safe and well. And then if they need to use certain powers and legislation, you can kind of do things in patients' best interest. So that's usually quite the extreme top of the pyramid, or a small number of people. But there's always it can get escalated to a level where the help is available. So keep trying, encourage them to see their GP, get them information. But if it is kind of feeling really risky, or feeling that it passes a certain threshold where you're really worried about them, then you can let people like the NHS know, or the police know if it gets to that extent, and they have powers to kind of make sure the person at least gets an assessment or gets treatment. I'm just going to jump up to the last few slides, Sarah, if that's okay. So we don't have time for this. There's a lot of in terms of the whole Islamic element, which is really important. You're all kind of familiar with the Yaqeen Institute. They've got, if you search or Google prophetic prayers for relief and protection, got a really nice kind of document around that. And this is a very famous dua about grief and anxiety. And it talks about, I guess, there's anxiety, which is more looking about things, worrying about the future, but grief, is worrying about the past. So Islam has the 2 different Arabic words for that. But I think in terms of, to summarize, so You know, really important to remember mental health disorders are treatable. Get help sooner rather than later. It's not due to weak faith. You know, look after yourself as well. It can be stressful if you're looking after other people with mental illness as well. Sarah had asked me to get some resources as well, if you know who you can access. So you got your GP and in emergencies, the NHS 111. Mind and Rethink are kind of my mental health charities, which have lots of really good information. The Samaritans, you can call at any time. There's a text service called Shout, which you can just text Shout to that number, and it's kind of a text-based service if you need help. There's a Muslim Youth Helpline, and there's also the Muslim Counsels and Psychotherapist Network. So you can find a therapist through that MCAPN. And I'll do a little wee plug for something else. So I do a podcast as well, but it's not a shameless plug, Sarah. But the reason is we've got some certain videos where there's we did a series on coping with stress and anxiety, and so we had a scholar, Sheikh Abdulaziz Fredericks, talk from the Islamic perspective, and we had a CBT therapist who spoke about theirs, and you can find that on YouTube, but also on audio as well. So that's a website that's kind of hopefully trying to raise awareness about mental health issues as well.
Jazakallahu khair. I think we've come to the last of our questions. Really appreciate your time. I'll hand over to Sophia now to thank you properly.
Sure. Jazakallah khair. Thank you so much, Dr. Durani, for your expertise and this incredibly valuable session. So, yeah, I'm sure everyone here has really benefited and learned something new about coping and caring for yourself and your loved ones. Many thanks also to Auntie Sarah for hosting and taking the time to organize this session. I just wanted to end with a dua. May Allah bless us all with a fruitful and successful academic year ahead. May He grant help and support to those who are struggling with depression or mental health, and may He guide us along Sirat al-Mustaqim, the straight path. Ameen. Finally, I just wanted to say, keep an eye out for our next monthly development circle, which is going to be on Wednesday, the 18th of October, by our very own Dr. Rizwan Sayed on halal and haram, the local and prohibited. Thank you, everyone.
Thank you, everyone. Thank you, Sophia. Assalamu alaikum, everyone.
Walaikum salam.